Hi, and welcome to our video on PET scans. Maybe you've heard of the term PET scan before. PET is a commonly used imaging technique used for both clinical and research purposes. For example, it is often used in oncology to detect tumors in possible cancer patients. The term PET stands for positron emission tomography. A positron is an antiparticle of an electron. This means it has the same mass but the opposite charge. Emission refers to the release of the positron from the radioisotope. Tomography is an imaging technique that produces a 3D image of a structure in a solid object through differences in the passage of waves through that structure. PET was developed in the late 1950s with the ultimate goal of measuring and visualizing physiological processes in vivo, such as metabolism, blood flow, and the concentration of proteins in various receptor systems. Since then, PET has been used extensively in preclinical and clinical settings, mostly for oncological purposes, but increasingly also in areas of cardiology and neurology, such as the diagnosis of Alzheimer's disease. It can be used for the investigation of synaptic plasticity, neuroinflammation, and neurodegeneration. In research, PET is used to visualize receptors and determine their occupancy, which is useful in clinical trials for new treatments. It can also provide information on the molecular level before any structural and anatomical changes are present by targeting proteins. This makes it a very useful technique. PET is based on the principle of decay. A nucleus has a certain number of protons and neutrons, and depending on those numbers, they are stable or unstable. If they are unstable, they decay into a more stable form. There are multiple types of decay, but the one that is relevant for PET is called beta plus decay. In beta plus decay, a positron is emitted, hence positron emission tomography. In the nucleus, a proton decays into a neutron, and a positron is emitted. A positron is also known as an anti-electron, or the antimatter counterpart of an electron. Take for example fluorine 18. We have the F for fluorine, on top is the 18, which is the mass number, the number of protons and neutrons, and at the bottom is 9, the atomic number, the number of protons. With the decay of a proton, the atomic number will decrease by 1, but the mass number stays the same, because we gain a neutron. With 8 protons, we now have an oxide atom. To make the reaction complete, we add the positron that was emitted. A positron then travels through space, or tissue, before it annihilates with an electron. Combining matter, the electron, with antimatter, the positron, results in 2 gamma rays, a type of photon. These 2 gamma particles travel in opposite directions. This way, the momentum is conserved. The gamma particles are what we measure with the PET scanner. But before we are able to measure those rays, we would need to be sure that there is decay in the patient at the area that we want to measure. For that, we use tracers. Which tracer we use depends on what we want to measure. For example, fluorodeoxyglucose, also known as FDG, is similar to glucose and is used for detecting cancer or other high metabolism processes where there is a high uptake of glucose. And F-DOPA, comparable with L-DOPA, is used in, for example, Parkinson's disease. When developing a tracer, we essentially attach a radioactive isotope that has beta plus decay to a molecule. An essential part of this isotope is the half-life, which is the time it takes for half of your isotopes to decay. You want to be able to measure the decay in the patients, so the half-life can't be too short. But the patient shouldn't be radioactive for days or months after the PET scan, thus it can also not be too long. In the example of fluorine 18, it has a half-life of about 2 hours. This way, it is possible that it can accumulate in the body for about an hour before measuring. With the PET scan, we can then see where a ligand has accumulated. So now someone has a radioactive tracer in their body, but how do we measure the gamma radiation from the positron annihilation? As mentioned before, 2 gamma particles travel in the exact opposite direction. A PET scanner surrounds a patient. This way, the 2 particles can be measured on both sides, and it is possible to trace back where the source of the radiation is. When a gamma particle, which has high energy, reaches the machine, it hits the scintillator. The scintillator produces multiple photons with low energies, optical light that we can measure. The number of scintillation photons produced is proportional to the energy deposited by the annihilation photon. A commonly used detector is the photomultiplier tubes, also known as PNTs. It is a vacuum tube where the incoming light photons produce electrons that are accelerated and amplified. This creates an electrical current, which again is proportional to the amount of photons. And this information is used to create the images. Images are created using back projection or iterative reconstruction. In back projection, the line between the two detected signals, also known as the line of response, is reconstructed. When this is done multiple times, this produces an image. This image is blurred, but can be made clearer using a filter. In iterative reconstruction, an image estimate of what we expect the brain to look like is made. We then use forward projection to see how well this matches the measured projection. If the two images are very different, the image estimate is adapted to better fit the measured projection until the two projections match. This way, an image is computed and adapted until it is well suited. Overall, iterative reconstruction is preferred over filtered back projection, but this is still debated. However, gamma particles may interact with electrons in the matter, which can lead to inaccurate detection of gamma rays. The extent to which the signal is disrupted depends on where the collision between gamma rays and electrons occurs. In case of absorption, a gamma particle hits an electron in the inner shell, which sends off an electron known as a photoelectron. This stops the high-energy gamma particle and replaces it by a low-energy particle, greatly reducing sensitivity in detection. Another possibility is Compton scattering, in which the gamma particles interact with an electron on the outer shell. Again, the electron, in this case called a recoil electron, moves away. The gamma particle continues but has reduced energy and can deviate from its original path. This leads to inaccurate localization of the region of origin. Positron emission tomography can be used on its own, but it can also be used in combination with either a CT or an MRI scan. Though PET is useful in providing information on physiological processes, it gives very poor structural information. This is why a CT or MRI can be performed at the same time. This will correct the image obtained through the PET scan. However, a disadvantage of combined CT and PET is the high radiation exposure. This is lowered when a combined MRI PET is performed. This technique is also more beneficial for softer tissue. A limitation here is that there can be magnetic interference between the two modalities. This can be solved by replacing the photomultiplier tubes with photodiodes, which are easily integrated into the MRI machine. PET scans are beneficial as they demonstrate the biochemical changes in the body in a 3D image, whereas a CT or MRI scan identifies anatomical changes. A PET scan therefore helps to identify problems at the level of their activity and function, which might change long before any changes in body structure become apparent. This allows for earlier diagnosis and more effective treatment of diseases such as cancer, and also more detailed imaging of other conditions. There is little risk involved with the intravenous administration of the radioactive tracer, as the tracer has a short decay time of only a few hours and is quickly removed from the body. Compared to fMRI, PET has a lower temporal and spatial resolution, but it is better at measuring physiological processes and is therefore a more direct measure. The risks associated with a PET scan are very small and are due to reactions to the radioactive tracer injected. However, the chances of a negative reaction occurring are incredibly low, as the level of tracer given to a patient is very tiny. The radioactive substance also has a very short decay, which is good news regarding risk of radioactivity, but can lead to issues as appointments must run on a tight schedule. PET scans can sometimes show up areas of high activity, which may be mistaken for cancers. Inflammatory conditions like rheumatoid arthritis or tuberculosis absorb a lot of the tracer, and so can cause confusing results. A PET scan is less accurate in a few situations. For example, slow-growing, less active tumors may not absorb much tracer, and small tumors may not even be detectable in the first place. High levels of blood sugar can also cause the cells to absorb this normal sugar rather than the radioactive injected kind. Patients are usually fasted for 4 hours before a PET scan, and blood sugar levels are measured to lower the chances of this happening. PET scans are also a very expensive form of imaging and are not readily available. They often accompany other scans, such as CT and MRI, in order to be diagnostically effective. In conclusion, PET is a useful imaging tool for providing functional information on physiological and metabolic processes. It is based on the principle of positron emission as a result of radioactive decay, and it can be used effectively as both a medical and research tool in clinical and preclinical settings. Thank you for watching.